Okay, so you're going to have a hip or a knee replacement. This is Dr. Gundusky. I'm going to talk to you a little bit about what to expect during the day of the surgery so you can prepare. There's more information on my website about what to expect during the actual preoperative education I have patients go through. So this will be a kind of a brief overview of the day, but there is a full preoperative education video on my website that will kind of go over a lot of things that are specific to my patients, but pretty universal amongst a lot of joint replacement surgeons that will talk about things to think about before surgery. That's this talk, which is the preoperative joint class. This talk is really a lot of slides I've taken from that talk and kind of boiled down into just the surgery day. But that, again, that whole video is on my website. So the surgery day is when you'll come in, obviously, and have surgery. On waking in the morning, you'll generally shower and comply with the facility NPO or nothing by mouth policy. This is a typical one for most patients from an NPO standpoint. So we have a HIBA protocol, which basically has you shower with HIBA the night of and morning of the surgery. And then no solids or clear liquids after midnight the day before the surgery, except for clear liquids are permitted 4 hours before surgery start time. Again, this can change between facilities, but for the most part, this is a pretty common one for me. Just make sure you check with your facility to make sure you have the right policy. But generally, this is pretty common that we will let you do things like drink clear liquids. And it's really important to understand that clear liquids are things like water, sports drinks like Gatorade or Powerade, pulp-free fruit juices, plain black coffee or tea. So no creamer, no milk, nothing with pulp, nothing with substance, just clear liquids up to 4 hours before your surgery start time. So that's what you're going to do in the morning. And then you'll arrive at the facility usually sometime between early morning and late morning. You'll show up usually with your coach or your driver. Your show time will be given to you a day or more before the surgery day. So a lot of patients want to kind of know this as soon as they can. It is sometimes a little tough really to give that way ahead of time because the OR is such a busy place. There's a lot of emergent and non-emergent things going on. And so telling people exactly when to show up for showtime, generally we can give a range to, but really it gets confirmed 1 or more days out from the actual day of the surgery. And then you're going to check in. You'll be brought back to the preoperative area after some paperwork is filled out. In the pre-op area, you will do things like change into a gown. Your pre-op nurse will take care of you, reviewing your medical history, medications, and allergies, take vital signs, including your height and weight. They'll start an IV. They'll complete your skin prep, which generally includes some nasal swabs and antiseptic skin wipes, and they'll shave or clip the surgical site. So note, make sure you don't do that yourself. We're going to do this when you get to the preoperative holding area. We'll also give you some preoperative medications, very common things like Tylenol and an anti-inflammatory will be given before surgery to help with perioperative pain control. Also in the preoperative area, while you're waiting, you'll meet your anesthesia team. They'll discuss the type of anesthesia that is best for you. In general, I prefer and we prefer local or spinal anesthetics with IV sedation. There's reasons for this, including outcomes, which are better with lower risk, and overall ability to get up and walk and ambulate with therapy, which tends to be better. So those are the preferred anesthetic type in most patients, and your anesthesia and I will talk to you about that. And then me or your surgeon will come see you, and we will sign the extremity that we're going to operate on and answer any final questions about things you have before surgery, and talk to your ride and make sure everybody's on the same page with your medicines after surgery. We'll make sure that the therapy is set up after surgery, and we'll make sure you understand everything that's about to happen. In the operating room, you will be comfortable. I always tell people we could not do the surgery if you were not comfortable. So we will make sure that you are comfortable and can't feel pain and can't hear anything and can't see anything. And you are most commonly snoozing and taking a nap. Most standard joint replacements take about an hour of actual surgical time, and then about another 30 to 60 minutes are needed for anesthesia, positioning, and preparation. So usually this totals about 2 hours in the operating room, and then you'll move to the recovery area. Sometimes you'll go home right from this recovery area. Other times you'll be transferred to a different short stay area, and then use that area to get up and walk and do your therapy with, and then go home. After surgery in the recovery area, which will be about an hour and a half to 2.5 hours, you'll basically get everything ready to go home. We want to see all the discharge criteria, meaning that we want you to have good, stable vital signs. We want you to be comfortable with minimal to no pain. We want you to be able to urinate. We want you to be able to eat. We want you to pass your therapy test. And, it's surprising to people, but you will be up and walking right away, immediately after surgery. Within an hour or so after surgery, you'll be able to walk on the extremity, put full weight on it, and walk. Everybody does start with a walker because it's the most stable thing, and it's not necessary from a weight bearing standpoint. It's really just for a stability thing. After anesthesia and starting out after surgery, we give you a walker because it is the most stable thing to prevent falls, and that's really what everybody starts on. Slow transitioning to a cane afterwards, usually pretty quickly, and pretty limited use of walkers for the most part. But we do start with those. And look at this patient. You will be able to walk up and down a small set of stairs hours after surgery. So we will practice these with you, mostly from a comfort standpoint. We want to make sure you know how to get up and down a set of stairs, and also just to make sure you're comfortable with that, because that's a common question that patients have. They have stairs to get into the house, and they want to make sure that they're comfortable to do that. So we'll practice before you go. So before we go, we'll make sure you meet those discharge criteria. And we'll also make sure you have everything you need. So we will make sure we have the therapy plan set up. We'll make sure you've gotten your medicines and have a plan to go over the medicines, and we'll go over all those about how to take them. And then we'll make sure you have equipment. Really, the only standard equipment people need with joint replacement that I do is a walker and an ice pack, both of which we will give you. So sometimes a walker you already have at home, or we get ones for you before surgery. If not, we'll get you one on the surgery day, and that's easy. And otherwise, an ice pack is nice, and we'll get you one of those after surgery as well. Other things that you'll hear about people getting aren't completely necessary. It really depends on your age and your frailty and things like that. But for the most part, a lot of the other things aren't necessary that people get after surgery. There's more information about pain control in my full preoperative education video, but in brief, we plan what's called multimodal analgesia after surgery. We basically use multiple different medicines and ice to control pain, and the goal is always to limit narcotics to as little as possible. That is really one of the biggest things that has made joint replacement more comfortable for patients over the last years, is our ability to really understand that multiple different benign medicines and limiting narcotics is really what helps them get up and moving and walking early, but also controlling pain. So that's kind of the art of medical management with joint replacement, and that's what we do. And so again, there's more information about that in that full preoperative video. For me, my hips get a waterproof dressing and can shower right away. For knees, I put an ACE bandage on top of that waterproof dressing and take that off in a few days, and then patients can shower. Usually both of those surgeries get absorbable sutures, and sutures or staples to take out afterwards. And we're really going to talk about ways to ensure success and minimize problems. That's the whole goal, really, in the first, especially 6 weeks after a joint replacement, is to make sure you do well, get off to a good start, and minimize risks. Okay, so we'll talk about all of those things, but we'll talk about how to control pain, how to manage the dressing, which is easy, how to prevent complications, and then we'll also make sure that you understand how to contact us. You can find out a lot more about the surgery day and other topics on my full preoperative education video on my site, or you can learn more at these trusted websites as well. The American Association of Hip and Knee Surgeons site, as well as the American Association of Orthopedic Surgeons sites, are really good locations for this type of thing, especially the American Association of Hip and Knee Surgeons. A lot of good topics about hip and knee arthritis, hip and knee replacement, and there's also some therapy exercises before and after activity on that American Association of Hip and Knee Surgeons website as well. So those are really useful. And again, make sure you're going to trusted websites when you're getting this type of information. So thank you. Hopefully you learned a little bit about the surgery day itself, and you will be a little more comfortable with the process and understanding what you are in for on the day of surgery. But in general, these days should be relatively straightforward for you. You should be very comfortable. You should come in, you should get anesthesia and be comfortable. And then most patients are surprised at how good they feel and how easy the day was, when obviously it's something that there's a lot of anxiety about, and it's a big procedure that's kind of scary. So hopefully this helps a little bit, and look forward to you hearing any more talks you want to, or seeing you in the office. Okay, thanks. Bye.